Hi, and welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist. And most likely you are viewing this video for one of two reasons. Either you have completed the exercise program number 1 for the shoulder, and you've had good success. You have a decrease in pain. You can do some of the things that you weren't able to do before. And now you just want to work on some more strengthening for that shoulder. So if that's the case, then great, stay tuned, because you're definitely going to find some strengthening exercises that will get you even further on your way to feeling better and doing the things that you need to do. The second reason you may be viewing this video is because maybe you didn't have that nagging, aching, or sharp pain on a daily basis, or that kept you from sleeping at night, but you have been having some shoulder pain off and on with certain movements or activities. And maybe that pain just comes and goes throughout the day, or you may even go a few days without having shoulder pain until you perform a specific activity. You may even be having some stiffness in the shoulder, lost a little bit of motion, and in that case, you can start with this exercise program, the shoulder exercise program number 2, which involves weights, dumbbells, or even soup or bean cans. And if you find that you can start here and tolerate this particular exercise program well, then just keep going. If you have chosen to start here and you do, and within a week or two you're actually noticing more pain or more irritation to that shoulder, then that's a really good sign from your body that you need to back up. Perhaps start with exercise program number 1. You may only need to perform that program a week or two before you can come back to this and progress to strengthening exercises. So stay tuned, because I'm going to just show you an exercise program for the shoulder using weights, dumbbells, and just get you back to doing the things that you need to do. So the first exercise in this shoulder program number 2 is called shoulder flexion. Now if you did shoulder program number 1, then you're familiar with this exercise, and we're just going to add some weights to it. So it looks like this. I'm using some 3-pound dumbbells right now, but I want you to use the amount of weight that you need to use to get fatigue in those shoulder muscles, but not produce your typical pain. You can get dumbbells at your local Target or Walmart. If you're not up to purchasing dumbbells, then you can even just try some cans. I have a can of soup and a can of beans. The beans are a little bit heavier than the soup. I've also had, over the years, just patients come up with really creative ideas for weight. I had one patient come up with a sock that he filled with just coins. And then he actually weighed that, and that's what he used for his weight to do the exercises. I've had patients use a hammer, again, that has some weight to it. But anything you can find around your house that has weight to it, weight that you can tolerate, you're free to use, and something that you can hold on to. So anyway, back to the dumbbells. So when you start this exercise, you want your elbows bent so that your hands are facing straight out in front of you, and the exercise looks like this. Okay, so let me just show you from the side. You're going to keep your elbows bent when you do this exercise. Okay, again, that's what it looks like. I want you to go as high as you can without producing your typical shoulder pain. This is all the higher you need to go. And I want you to go that high if you can do that without producing your typical pain. If you try this exercise and you do get some of your typical pain, then just stop shy of that pain that you get. When you do this exercise, I want you to do 3 sets of 12 to 15 repetitions. There's a range there because depending on the weight that you do, you might get really fatigued and really tired at 12. You may need to go on to 15 to get that fatigue feeling that I'm talking about. You want to make sure with each set you get a fatigue or an ache in that shoulder, but not your typical shoulder pain. When you do this exercise, I want you to rest 10 to 15, even up to 20 seconds in between each set. Now, the good thing about this exercise program is that you only need to do this exercise program once a day. If you have already been through the shoulder exercise program number 1, you know that I wanted you to perform those exercises 3 to 4 times a day because the shoulder needed that. The muscles and all the structures in that shoulder needed that repetition. At this point, if you're having less pain and you're getting back to things, then you need to work on strengthening. But doing these exercises once a day should be sufficient. I would like you to try and perform these 5 to 6 times a week. I know that's a lot, but for right now and to get strength, you need to be able to do these 5 to 6 times a week. For this exercise program, I would like you to commit to trying this program for 4 to 6 weeks. If you find anywhere in that time period that your strength is better, you can do everything you need to do, then you're free to stop. If you find that you just want to have a little bit more strength, you're still finding you have some difficulty with lifting or pushing or pulling, then continue with this exercise program until you feel like that strength is good.